Welcome to Monday's edition of COVID-19. There's been a notable decline in Korea's daily tally today amid the weekend factor. Accordingly, authorities are urging for public caution as variables remain, including the growing presence of variants here on the local front and also around the world. We start now with the broader pandemic coverage. So I understand our tally is hovering on the 400 level.
Right, Sunny. Let's start right off with Monday's tally. 463 infections were reported as of 12 a.m., and that includes 436 domestic transmissions and 27 cases from abroad. And that's raised the total in Korea to 127,772. Now, the daily caseload had peaked to above 700 on Saturday, but then we are seeing a straight decline for the past 2 days. But as Sunny earlier mentioned, we will still have to take a look at the rest of the week due to the fewer tests conducted over the weekend. But we are also seeing a decline when we take a look at Monday's figures. So we have been going down from the high 500s to the mid 400s now. And also the average reproduction rate in the past 2 weeks has been below 1, which officials are translating as a positive development. Now, meanwhile, there are still risk factors remaining, though, with some national holidays this month, as well as other special events. And also, the UK variant here in Ulsan is causing concern. 24 cases this Monday, because this is now showing signs of spreading to the capital region as well. And also, the South African variant has been detected in the capital region, such as Gyeonggi-do province, through community spreads.
I see. And against that backdrop, the president, I believe, has touched upon our vaccination drive.
Yes, Sunny. During his special speech marking the 4th anniversary in office, President Moon Jae-in said the end of the battle against COVID-19 is approaching, calling for a little endurance and promising this.
방역 당국과 전문가들이 우리의 방역 상황에 맞추어 백신 도입과 접종 계획을 치밀하게 세우고 계획대로 차질 없이 접종을 진행하고 있는 것은 정당한 평가를 받아야 한다고 생각합니다. 9월 말까지 접종 대상 국민 전원에 대한 1차 접종을 마쳐 11월 집단 면역 달성 목표를 당초 계획보다 앞당길 것입니다.
Staying on the vaccination front now, we have over 3.67 million people here in the country who have received at least 1 dose of vaccination. And beginning this Monday, booking for vaccinations for the age group 65 to 69 has kicked off, and this group will receive the AstraZeneca vaccine. In the meantime, Korea's drug regulator announced today that the Moderna vaccine showed a 94% efficacy rate. That was the first result out of a 3-step review. Let's now move on to our global updates. The U.S. now is seeing a decline in cases, some 22,000 new infections. But India here had at 22.6 million cases in total, had over 360,000 infections again in just a day. And now here in the UK, although daily cases have dropped to below 2,000 here due to fast vaccination, the Indian variant has also made its way in this country, causing for concern there. And with just 2 months left until the Summer Olympics in Tokyo, Japan saw for the first time over 7,000 infections on Saturday, and also state of emergencies have been extended until the end of May in major cities. Now, last but not least, let's take a look at the global figure of infections here at 158.9 million. Those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
All right, so thank you for now. Right, back on the domestic front, the psychological toll of the prolonged pandemic appears particularly pronounced among the youth in our society. We have details in this report.
Today, we're at a youth culture center in central Seoul. After months of calm amid the pandemic, the venue is bustling with fresh activity as it celebrates Children's Day.
코로나 사태로 인해서 청소년들이 참여 활동이 많이 제한되면서 외부 활동도 많이 줄어들게 되었습니다. 집 밖에 나오지 못하는 스트레스를 저희가 조금이라도 풀어주고자 청소년 페스티벌을 기획하게 되었습니다. 각 타임에 30분마다 이제 계속 환기를 실시를 하고 전문 기계를 활용해가지고 방역 규칙을 준수하면서 운영하게 되었습니다.
Thanks to this event, the children and their parents in attendance were able to leave their woes behind for a brief moment. Stop-start school curriculums and restrictions on outdoor activities have taken their toll on many students. So what exactly are their greatest challenges?
학교를 못 가가지고 이제 애들이랑 더 친해질 수 없다는 단점이 있고요. 이제 더 게을러져가지고 저 같은 경우에는 학교 성적도 떨어졌거든요. 애들이랑 놀 때도 마스크를 끼고 대화를 하니까 이제 애들 표정 같은 것도 잘 알 수가 없고
과제 같은 게 있으면은 학교에서 뭔가 도움을 받을 수 있는 부분들이 있는데 그런 거 없이 집에서 혼자 해결을 해야 하니까 그런 게 조금 힘든 것 같아요.
The COVID-19 pandemic has had a measurable mental health impact on Korean children, who reported less life satisfaction, as well as more feelings of depressed mood and anxiety, according to a recent survey.
아이들이 학교를 안 간다는 건 단순히 공부를 못한다 이게 아니라 내 옆에서 나를 지지해주는 친구들, 농담해주는 친구들, 나를 응원해주는 선생님 이런 사람들을 못 만난다는 얘기거든요. 이제 어른들도 그렇지만 우리가 어려운 상황을 경험을 했을 때 가장 힘이 되는 거는 사실은 주변에서 지지해주고 도와주고 내 얘기를 들어주는 사람이거든요.
The survey showed that the lack of outdoor activities and live interactions with their friends had the most detrimental impact on their emotional well-being.
저는 집에서 혼자서 뭐 게임으로 풀거나 아니면 집에서 이제 요즘 랜선으로 많이 하잖아요, 애들끼리. 영상통화하면서 같이 놀거나 그래도 약간 혼자 있는 것 같은 느낌이 드는 것 같아요.
새로운 친구를 사귀는 방법들, 새롭게 공부하는 방법, 또 새롭게 가족들과 시간을 보내는 방법, 또 새롭게 친구들과 연락을 해야 되는 그런 방법들이 전혀 기존과는 다르게 비대면으로 진행되고 또 온라인으로 진행되는 부분에서 어려움들을 많이 겪고 있다고 들었고요.
The switch to remote learning has also led to a surge in cyberbullying, which has tripled compared to a year earlier. Most parents agree that the resumption of in-person classes is crucial to their children's development.
어른의 1년하고 다르잖아요. 아이들은 1학년 때 할 수 있는 게 있고 2학년 때 할 수 있는 게 있는데 그냥 그 시간을 앞으로 못 채울까 봐 그런 걱정이 있긴 하고 학교가 아이들을 돌봐주고 학교에서 좋은 수업과 프로그램들을 제공해 주는 게 얼마나 소중한지를 더 생각하게 된 것 같아요.
So what can be done to help our children mentally cope with the pandemic?
집에서 어떤 서포트를 받느냐 그리고 아이가 어떤 환경에 놓여 있느냐라는 차이가 코로나19로 인한 아이들의 심리적인 차이에도 많이 영향을 미치는 것 같아요. 수업뿐만 아니라 아이들의 그 공동체 자체도 좀 지켜주는 그런 관점을 가지고 아이들을 좀 도와줄 수 있으면 좋겠다. 그리고 무엇보다도 어른들 옆에서 같이 응원해주고 만들어주는 것 그런 것들이 좀 필요할 것 같습니다.
Children in their formative years may be more sensitive to the changes brought on by the pandemic, and they need the help of grown-ups more than ever before to guide them through these difficult times.
Right, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Monday. Now, do make COVID-19 testing a priority should you feel a little bit under the weather. Preemptive testing, as authorities point out, will serve to stem possible cluster infections that may dramatically raise the number of new cases. Now, while we wait for the briefing to start, here are a few words related to possible discomforts after COVID-19 vaccination. First, medical experts say it is normal to feel uncomfortable for up to 48 hours post-inoculation. I believe the briefing is about to start. We'll come back to you afterwards with a summary.
네, 안녕하십니까. 질병관리청장입니다.
I am Commissioner of the KDCA, and let us now begin our regular briefing for May 10th, Monday. And starting from today, we are receiving the bookings for the COVID-19 vaccination appointments for senior citizens aged over the age of 65. And also starting from last week, we have receiving the booking advancements for those aged over the age of 70, and we have have had about 40% of these group giving their consent to get the vaccines. And we ask you to also book in advance for these COVID-19 vaccination appointments. And you can also do so online and offline as well at designated hospitals. And after the inoculations, we have some post-inoculation adverse responses. And here are some supports for the treatment costs. And here are some updates to our measures. And there have been some areas or some people who have been undergoing critical illnesses or symptoms after the COVID-19 vaccination. And we will also expand the scope of treatment cost support. And we have been seeing that there have been some lack of official documents to prove the correlation between the adverse responses and the vaccinations. And in order to complement these lacking of areas, we will also expand the scope of treatment costs. And to this end, we also would like to expand the cost of treatment to those people who have been hospitalized in ICU after the COVID-19 vaccinations, or people who have been experiencing severe reactions or symptoms. And in particular, we also would like to go over the basic and fundamental response screening by the local authorities as for the people who have been reporting their adverse responses, and as for the cases that have been deemed to have a lack of evidence. So these are the people who will be subject to this expansion of cost of treatment, and they will be eligible for the cost of treatment by reporting to the local community health centers and the community centers. And within per each person, the cost of treatment support will be limited to 10 million Korean won. And also we will be having the training and education for these related measures, and we will be rolling out these supports starting from the 17th of May. And this is a measure to enhance the government's duty to respond to any adverse responses that are experienced by the vaccine recipients. And we also will be transforming the coverage of these the treatment costs for those people who are experiencing adverse responses, especially including those who have severe symptoms, and they will be expanded to cover all of the costs while they have only had about 300,000 Korean won that had been covered earlier. And also we will be streamlining the necessary documents that they need to apply and submit for such registration. And we also have our private panel screening, and we will also try to maximize the utilization of such adverse responses screening so that we can provide more detailed information and on a transparent manner. And as for the post-inoculation adverse responses, here are our weekly analysis. Starting from the 2nd and until 8th of May, we have looked at the rate of these reports, and about 0.1% was the report rate, and about 0.8% were women, while 0.4% were men. And by age group, those between the age of 18 and 29 had the highest at about 30%, and also those above the age of 70 had about 0.2%, which was the lowest among all age groups. And as for these adverse responses, we have been looking at the correlations of the blood clots, and we are making sure that starting from the 3rd of May, we have also the DUR, which is the services to utilize the medical treatment to the hospitals so that the medical professionals can treat these blood clots if they appear among the inoculation recipients. And here are also our screening analysis updates. And up until now, we have had 11 rounds of meetings on the compensation, and we looked at the 79 deaths and also 77 cases of severe reactions. And we have seen only 2 cases that have had correlation with the vaccines. And at this 11th round of our screening, we looked at the 2 rounds of the 2 cases which were re-examination, and they also were the cases that have been screened earlier. However, they have been pending due to the autopsy, and also the cause of death has been related to other underlying medical illnesses which were related to their heart disorders. And to this end, we have seen no correlation with the vaccination. And as for the re-evaluation done on the critical symptoms, we have seen that this case has been evaluated first during the 6th round of a meeting. And they also concluded that there needs to be a comprehensive screening and analysis. And they gathered more information, and they saw that this could be a cause of other medical illnesses aside from the vaccine. And we are looking at these correlations of these cases, and we have deemed that there are not enough sufficient amount of data or documents that could be found here in Korea. And so we believe that this could be subject to the expansion of the treatment costs that we have just announced to you before. And also we have seen most of the correlations of the death were related to other underlying medical illnesses, and we saw that it is difficult for us to see that there has been a correlation with the vaccine. And as for 2 other cases of death, they are under autopsy, so we will be revealing the details as soon as possible. And we also looked at the 20 new cases of adverse responses which were severe symptoms. We looked at the period of the occurrence of these symptoms, and looking at diverse factors comprehensively, we saw that these adverse responses were caused by other regions aside from the vaccines, meaning that it was difficult for us to say that there has been a correlation with the vaccine. And starting from last week, we have also resumed the vaccination rollout by age group, and we have about 4,000 consultation personnel who are dispatched to the KDCA and Health Ministry. They are also responding to the phone calls. However, we are seeing a very high amount of phone calls, and so there could be some congestion. So as for the children of the senior citizens, we ask you to also help your parents to book for the COVID-19 vaccination appointments utilizing online websites and also through offline means as well. And you could also do so for your parents through online. And if this online registration is difficult, please carry your IDs and your mobile phone number. And when you go to the local the public services center, you could also get help from there as well. And starting from the 13th of May, which is Thursday, we also will begin the booking of the COVID-19 vaccination appointment for those between the age group of 60 and 64. So please take that into account. And also next we have some updates on the inoculation for people who need to go abroad. And up until now, we have been providing vaccine inoculations for people who need to leave the country for necessary and essential travels for business purposes or public services. And we have been looking at the countries of destination, and depending on their the list of risks, we have been screening the vaccine rollout. And starting from the 3rd of May, we also have been giving the vaccinations for people who are dispatched to overseas, including those from the private and personal and the public sector, that is. And they also include their immediate family members as well. And in principle, we are rolling out the AstraZeneca vaccines. However, if their age is below the age of 30, or if they cannot have their second dose due to time restraints, or if they are visiting countries where the COVID-19 new variant is prevalent, we are providing the Pfizer vaccines. And also, we have the weekly analysis of the COVID-19 outbreak. And lately, during the past week, we see the average daily cases is about 563. And compared to the previous week, this is about a 5.3% decline. And by region in Honam, Gangwon, and Jeju, as for these areas, we have seen that there are cluster infections at multi-use facilities, and they have seen a rebound in the number of cases. And as for imported cases, we have seen a daily average of 22. And compared to the previous week, we have seen a decline by 8.1 cases. However, we are seeing a global resurgence of the virus, and especially in India, we are seeing a rapid spread of the virus, meaning that we are still exposed to possible risks of influx of these imported cases. And compared to the previous week, we also see a slight increase in the proportion of critically ill patients. And as for all of the people who are traveling in from overseas, we are mandating them to go under 14 days of quarantine, and also submission of PCR negative document. And as for people coming in from India or South Africa or Tanzania, which is also seeing increase of the number of new variants, we are also mandating that they need to go under 14 days of quarantine. And as for the cluster infections of these new variants, we are expanding the subjects of the contacts, and we are intensifying our monitoring, and we are looking at their communities as well, so that we can respond to the regions where the new variants are prevalent. And in order to contain the influx of the new variants, we are also continuing to ask to people with clinical symptoms of COVID-19 to get tested as soon as possible. We are also expanding the preemptive testings to many communities, including those who are giving childcare services, education, and senior citizens services as well. We are also intensifying and bolstering our inspection for high-risk facilities and workplaces. Currently, we are seeing a rapid spread of the virus globally, and here in Korea, we are seeing hundreds of new cases as well. And it is very important to safeguard the lives and the health of those people aged over the age of 60, and especially looking at the fatality rates, they account for about 95% of all of the fatalities related to COVID-19. Nevertheless, on the other hand, with just a single dose of the jab of COVID-19, we believe that there is about 80% effectiveness in preventing the infections among senior citizens. We have been expanding the rollout of the vaccines for the senior citizens, and we have been beginning the booking for the COVID-19 vaccination appointments. So please advise your parents, senior parents, to have the booking in advance. Moreover, as for the senior citizens, in order to ensure that they have a safe vaccination, please check their health conditions before and after the inoculation so that they can have safe inoculation.
지금부터 기자님들 질의 답변 시간 갖도록 하겠습니다.
Right, that was Chong Kyung with Monday's afternoon briefing. So what did she have to say?
She had some updates on the vaccination as well as the adverse reactions after vaccinations. So if you remember, we had 11 rounds of meetings on post-inoculation conditions, and there were, out of more than 70 post-inoculation deaths, there were 2 cases which the government had repeatedly said that they have to look into that issue. So the final conclusion there is that there was no correlation found between the cause of death and the vaccination itself. And also the government says that it is expanding coverage of treatment costs for people with adverse reactions and even if there's no clear evidence that there is correlation between the vaccine and adverse reactions. And Tong also asked for the nation's people, especially for people who have senior parents, to cooperate in the vaccination campaign of the government, especially as beginning today. Registration will begin for people aged 60 to 64, it was, I believe, and 60 to 64 will start on Thursday, and those aged from 65 will start today.
Right. All right, so thank you for that.
My pleasure.
fully vaccinated and you're outdoors, you need, and not in a big crowd, you no longer need to wear a mask.
불필요한 모임, 자제, 그리고 마스크 착용 등 방역 조치가 중요하다는 말씀을 다시 한번 강조해서 드립니다.
Inoculation efforts continue amid the growing spread of variants that are challenging containment efforts here and elsewhere around the world. Now, for more on the global COVID-19 situation, I have Professor Yu Byung-wook from Soonchunang University. Welcome back, Professor Yu. And joining this session virtually is Dr. AliceHyunKyungTAN at Miss Mary Women's Hospital, who is currently in Seattle. Good to see you again, Dr. Tan.
Thank you so much for having me.
Right then, Professor Yu, let's begin with the domestic COVID-19 situation amid a host of family events, including Children's Day and Parents' Day this past week.
Oh, for case of me, I was a little alone because I was working in the hospital. I'm really sorry about my children and my family because they're being stayed at home. So, but meanwhile, I'm around in the hospital. I see the crowd of people in the street, and it's very difficult to make even the one reservation for a restaurant in the corner of where I work in the Itaewon area, which means the people are crowding and they are so tired, be the stayed at home alone. But meanwhile, last 6-7 weeks, Korean government quarantine policy was not much changed, but the number was a little bit fluctuating. Today, less than 500. It seems to be a little fine, but we can see the last week, we having the very serious yellow dust and the bad weather, also raining today. So it can be affected the number of the tests. So can be tomorrow till Wednesday, confirmed cases around 500, 600. But my little concern is when the weather is recovered, the people want to go to tests, probably number will be more than 700 soon.
I see. And Dr. Tan, what can you tell us about the COVID-19 situation over in the US?
Well, in America, overall, it does seem like COVID activity is downtrending. The number of daily cases, the 7-day average is about 42,000, which is a huge improvement compared to the peak during the winter surge when there were about 300,000 new cases per day. In terms of the daily deaths, that number seems to have plateaued. The 7-day average is 675. Again, this is much improved when at the peak in February, there were more than 5,000 deaths per day on the worst day in February. Here in Washington state, we are in the 4th wave of COVID-19, but currently much of the state is in phase 3, which is the lowest alert level based on daily new cases and new hospital admissions. In general, according to the Department of Health here, prevalence, however, is increasing. The estimated reproductive number is 1.5. However, hospital admissions have not been going up as happened during the winter surge, and that's probably due to the boost in vaccinations that's been going on. In terms of vaccination rates, that's really varied county by county. Here in King County, more than 90% of seniors older than 65 years old have had at least one shot of their vaccine. However, in the state overall, 25% of seniors have not even started their vaccinations, even with one shot. So there is a huge variation in terms of vaccination levels. However, in terms of looking at the modeling of immunity across the state, it's estimated that 1/3 of the state does have immunity to COVID-19. That's because of both vaccination and also prior infection. In terms of the variant, across America, the B.1.1.7 variant is now the dominant strain. Likewise, that's true in Washington state, where 80% of cases are thought to be due to the B.1.1.7 variant, and the P.1 variant follows with 10% of cases. So right now, I would say the picture is mixed. We have Many states trying to ease their restrictions, however, concern for the variants is high. And also, people are trying to push for the last, mile of vaccinations, trying to overcome vaccine hesitancy so that more and more people can get vaccinated.
Right, and before we get into details with that, let's now take a broader look, that is, at the spread of the virus here in this part of the world. I have Savitri Kondet-Jai over in Thailand, live on the line. Hello, Savitri.
Hello.
Now, Savitri, up until the end of March this year, Thailand's COVID-19 related numbers were remarkably low. But I hear a third wave that began in April is triggering frightening surges there in the country. Could you tell us more about this, please?
Yeah, it started on the beginning of April, and it started from the nightclub in Bangkok. So it spread out very fast. And also in the middle of April, we have Songkran Festival, which is a time that Thai will travel around the country, go back to their family. So it does, and the government doesn't block the travel between province. So it's make the situation somehow become worse. And because of this third wave, most of the people that had COVID-19 doesn't have any symptoms. So it's very difficult to control because they don't know if they have the COVID-19.
So you're seeing a surge in the number of asymptomatic patients then?
Yes.
So Savitri, what can you tell us about the vaccination campaign in Thailand against that backdrop?
The vaccination in Thailand still in a very low rate right now. They just started not long ago, and the government promised us that we can have 100 million doses of vaccine by the end of this year, but it's going to be a little bit slow. And for now, they try to catch up to vaccine the people in the affected area first, and also with the senior and people who are working in the front line.
So, Savitri, what is the response to the vaccination campaign among the people in Thailand?
People has doubt about vaccine because the FDA of Thailand has approved only 2 brands of vaccine so far, which is AstraZeneca and Sinovac. And they are concerned about the side effect of these 2 vaccines. So even the vaccine are open for register and available for some people now, they're still hesitating on register to get vaccine, and they want to wait for another brand that they can be certain of.
I see. So, Savitri, Thailand has a tough mask mandate in place, and recently the Thai Prime Minister, I believe, was fined for violating that particular mandate. Could you tell us a bit about that incident and about the public response to the measure?
Yeah, on the 26th of April, the Bangkok governor has ordered the new restriction for Bangkok area that everyone who go out in the public area must wear masks at all time. And in the same afternoon, the PR team of the Prime Minister has posted a picture on the social media. It's a meeting, and he was the only one who wasn't wearing mask in that meeting room. So the government sent police to the government house and fine him for 6,000 baht, which is $200.
I see. All right, Savitri, thank you very much for your words today.
Thank you.
Right, then back here in the studio. Right. Professor Yu, back here in the country, authorities in Korea appear particularly concerned about the spread of the South African variant. Why is this the case?
Well, the variants is very new, and we are now starting vaccination, but not enough. Also, we have many news and notice about the variants make the vaccine and treatment guides is going to nothing, which means sometimes we worry about like sci-fi movies is spreading more and the infectivity more and the fatality more, but actually this is impossible because the virus itself makes the spreading, but if the infected host die, it cannot be infected other side. So I believe that the variance is to make the little weaker, but spreading more stronger than other. But anyway, still more than 65 years old, the Korean people are they need the vaccination, but it's not finished yet. So our little concern is if these variants turn to the major variants, then other one, probably the victim can be happens.
Right. Meanwhile, Dr. Dan, there is talk about booster shots providing protection against variants. Now, how promising are these prospects?
Well, first of all, there are 3 vaccines in use currently in the United States, Pfizer, Moderna, and the J&J. And all 3 of these vaccines do seem to have high efficacy against the UK B.1.1.7 variant. However, there's a little bit of question in terms of the vaccine's efficacy against the B.1.351, that's a South African, and the Brazil P.1 variants. Pfizer reported recently that their vaccine showed high efficacy in South Africa, and so that is promising news. In terms of the durability of the vaccine's effectiveness, Pfizer recently reported that at 6 months, their vaccines seem to retain high efficacy, greater than 90%. In terms of at targeting the B.1.351 variant, both Pfizer and Moderna are in the works of making such a vaccine, but it doesn't look likely that they will be available in 2021.
I see. Professor, as is the case over in Thailand, a growing number of countries here in Asia are witnessing worrying spikes in COVID-19 numbers. What do you propose to address this fresh challenge?
Well, this challenge, we like to say, wear the mask first, back to the basic. Because the beginning of the campaign of the vaccination, the problem is right after the beginning of the vaccine campaign, people feel safe and released, even that just a small number of the people get a vaccination. Also, Songkran, she comments in the big festival in Thai. Also, the May, we have the kind of festival, Children's Day, Parents' Day, and the Buddha's birthday will soon. In the May, there's a big festival in Korea, is the same. So this can be the big challenge for Korea. So we have to learn for each other, Thai and Korea, Korean Thai. So when it gated open, number of the corona cases peak. So anyway, whenever we started the vaccinations, inoculation program, but back to the basic, wear the mask and keep a social distancing.
Right, and staying with face masks, Dr. Dan, while authorities in Thailand are tightening their face mask policy. I've just heard that we've lost the connection with Dr. Dan, so we'll continue our discussion here in the studio, and hopefully when she's back, we'll invite her back again then. Professor Yu, authorities here in Korea are calling on, that is, those who are fully vaccinated to abide by the basics, like you mentioned, wearing their face masks, keeping their distance. What are your thoughts on this?
Well, the vaccine is kind of basic. Let's remind and let's flashback in 2009, 2010. We have the new phase of the H1N1 crisis. It was really shocked that people are afraid about the H1N1, we are going to die. We were looking for the long queue for a vaccination. But anyway, now we are living among the influenza. How? Fully vaccinating for the risk groups, and we know how to prevent it. So we learned from the influenza, the H1N1 and annual influenza events. So even you done the vaccination against the COVID-19, but you should wear a mask and keep in social distancing, personal hygiene, the way at least 2 or 3 years more will good for you and you're safe.
Right. Dr. Dan, welcome back. Now, Dr. Dan, while officials here in Korea are calling on those fully vaccinated to adorn their face masks, I understand authorities in the US are easing the face mask mandate for those fully vaccinated when outdoors. What is the response, the public response that is, to this ease in face mask mandate over in the US?
Well, indoors, when there are 2 fully vaccinated people in the company of each other, I have found, especially healthcare professionals, as long as they're not in a healthcare setting, they will take off their mask. However, outdoors, as long as you're not in a crowded setting and you're not in the company of many people who are potentially unvaccinated or at risk, I think, and it's an open air setting, many people are happy to take off their masks, at the beach or hiking in the mountains, as long as there are not a lot of people around. The thing is, though, we're not sure, when we're outside in the public, who has been vaccinated and who has not been vaccinated. And so a lot of the healthcare professionals that I know, just as a courtesy, even outdoors, they will continue to wear their mask.
Right, and staying with those who've been vaccinated and those who've not, Professor Yu, what are your proposals, that is, to tackle the possible or potential debate over the do's and don'ts with regard to those who have been vaccinated and those who've not?
Well, so these days, we just having the less than 10% who are vaccinated. The problem is the not vaccinated people, first of all, we cannot make them to discriminate it to activities in the society because we are living same place, same time together. We just help them to encouraging having vaccination. That is more important. But anyhow, now what Dr. Dan, he comment about it. We don't know who had a vaccinated, who not vaccinated neither. So, which means until we have the little safety range more than 70%, we usually comment. Until that time, we should wear a mask. And unnecessary debate is not necessary, really not necessary. We should keep the mask until we are done, such amount of the vaccination done.
Right. Dr. Anthony Fauci has also said that the mask might become a seasonal factor, even after post-COVID-19, that is. Dr. Tan, in its latest guidance on the spread of COVID-19, the US CDC claimed that airborne transmission is the most common. Now, how does this shift in stance look to affect prevention guidelines in the US?
Well, the CDC, they did admit that airborne transmission is significant. However, they also stated that all of their prevention measures that they have advocated for so far will still protect against airborne spread. Their admission, however, is that infections can occur at distances greater than 6 feet, that's 2 meters. But that's why we need to keep our distance, wear a mask, practice hygiene. Their guidance has not changed per se in the light of this admission.
Right. Meanwhile, Professor Yu, the spread of variants here on the local front is quite a concern, especially given the situation in the southern city of Ulsan. What are your thoughts on the government's efforts to contain the outbreak of variants here in the country?
Please listen, dear our audience and watching the Arirang. Actually, the virus changes itself constantly. So the variants going to be the major variants in not only the Korean peninsula. But don't be shocked because already we have the variant among us. So, but if we keep on the social distance and wear a mask properly and avoid the cloudiness, you are saved from variants. So we cannot escape from the virus. We cannot escape from the new variants. But we have the two major of the we can handle it: vaccination and wear the mask. So don't be worried about too much because real world is not sci-fi, the Hollywood movie. Not all people die with this virus.
Right, and keeping in mind what Professor Yu has just said, Dr. Dan, what are your words of advice with regard to the presence of variants for ordinary members of the public?
Well, variants occur when there is more transmission. And so if you can keep the transmission levels low, then we can keep the level of variants also low. And so all of the advice that we've given so far in terms of the MAD HD TV2 that I've been saying, wear your mask, avoid crowds, distance, hand hygiene, test if you have symptoms, and the...
Dr. Dan? Right, I'm afraid we've lost our connection to Dr. Dan. We do apologize for the disruption in our connection with the US today in this particular edition of COVID-19. Anyways, Dr. Dan, thank you very much for your thoughts. And Professor Yu here in the studio, thank you very much for your words and your time and your words of advice, of course. Right, now adorning a face mask is perhaps one way of showing those around you that you're thinking of both their health and yours. Thank you for watching.